Hi, so I'm Dr. Sunil Richardson. I'm a maxillofacial surgeon. I'm currently practicing only out of South India. Haven't traveled abroad to the Middle East because of the pandemic. Here we have this pretty girl, and she has a main concern with her smile. Also because there is a lock in the anterior part of the teeth. We call it as a dental lock. I'm going to show you how that is. It's a form of an underbite. Look at that. So this is a partial underbite, and you can see bite. Yeah. Now we've taken a scans and we found that the upper jaw is actually sitting behind compared to the lower jaw. That's why when you look, you can see the profile is a slight C. This is looking very strong, and so we want to get the upper jaw forward by 5 millimeters only. You take it? So with that, what we're going to do is we're going to correct this crossbite issue. And once the upper jaw comes forward, it's going to be a high quadrangular lifovan type of osteotomy. So when I do that, a very prominent cheekbone is going to get less prominent. We're going to increase the vertical height on the middle third of the face. Also at the same time give the horizontal advancement of 5 millimeters. Later on, maybe 2 weeks later, she's going to undergo braces so that all of that is going to be aligned. And that might take a few months before the entire teeth are in proper alignment. So this is a combination of surgery first and braces next approach. She doesn't live very far from where we are, so she'll be able to come over and we should be able to get her braces done in the next few months. And I think by about 6 to 7 months she should have a very nice smile, much better proportions. There is the same issue of the upper jaw. If you see here, it's also a very squarish lower jaw. As I said earlier, we're not going to be doing that. I'm going to be increasing this height by 3 millimeters and getting it forward by 5 millimeters. And that's the plan for her. All the teeth are in good condition otherwise. This is the longitudinal view where you'll be able to appreciate also the cross bite anteriorly. You can see here how the relation of the upper and the lower jaw is. So we're about to start a jaw surgery here for this patient who has an underbite. This underbite is partial for her, it's not complete, so we're going to get the upper jaw forward by means of a high lifovan quadrangular osteotomy. I've planned to bring it forward by 5 millimeters. We've also made a splint ready. And she's going to go for braces after that. 3 weeks after surgery, she's going to be going for braces. And so this is surgery first approach. We're doing an upper jaw surgery, doing a lifovan osteotomy. We're going to get the upper jaw forward. You can see I've already made the osteotomy cuts. Now I'm using my lateral middle osteotomes to complete my osteotomy. It's a little difficult sometimes to. Okay, give me this. Now I'm just the septum, and then I'm going to use my osteotome for the lateral osteotomy till the cherry lines. And do a similar thing on this side. So now it's time to down fracture. You see how it comes down so easily just with my finger pressure. And that's all the mucosa, nothing is stone. You can see that. Clean cut. And then I'm going to use a hook to pull this maxilla. So you can see we're doing an advancement. There you see. I freed it completely on that side. There it is, totally free on this side as well. Now, put your retractors and wash. We're gonna just take off some of the bony spicules. So we fixed the upper jaw forward, as I said, 5 millimeters of advancement. I left a little bit gap there because I've also got some amount of vertical increase in the middle third of the face, but posteriorly there is contact. So just the anterior part of the upper jaw has come down while we have good contact posteriorly, and that enables me to increase the vertical height by 3 millimeters. And we're also bringing the upper jaw forward by 5 millimeters. You can see the gap there, and this is because we've got the posterior touch. So we just want the anterior part to come down this way and downwards. And so by doing that, what we're achieving is, yes, we're correcting our underbite. Also, I'm going to increase this much part of her face by that 3 millimeters and also project it by 5 millimeters. And you can see how nicely that's going to translate for a facial profile. Okay, cheek retractor again. So we could do different kinds of movements on the upper jaw as we can do on the chin, on the lower jaw as well, based on what the need is, based on the concern of the patient. We do an exactly opposite kind of a thing when patient has obstructive sleep apnea. All right. Yeah, that's easy. Look at the upper jaw. So it's come forward along with the nose. Look at the nasal tip, the shape of the upper lip. We've corrected all of that for her. I'm going to show you the side view as well. Look at that. She's got a much fuller upper lip now, much more proportional middle third of the face. So this is what an upper jaw surgery can do, bring about incredible changes. And this is immediately after we've just extubated the patient. And also you'll see that she's going to look younger because these nasolabial grooves that kind of come on patients who get older is also going to get, like, they're going to just disappear. They're already gone, as you can see. So these grooves are gone. The proportion of the lip, the shape of the lip, the point of the tip, the malar bone. Now because of a high osteotomy, it's not as prominent and our face itself has become more proportional.